Welcome, everybody, to this episode. Today, we are going to be talking about death. Why would we be talking about death? Well, that's because Kate and I will talk about absolutely anything. Um, and what prompted this one, for me, it's a time of reflection. It's a new year. So, symbolically, it is wintertime.
Mhm.
Death is part of this process. It's part of nature and part of our seasons. And then also personally for me, it's a year since my dad passed away. So we have very literal death and what it means, and then more the figurative and symbolic. And Kate and I were talking yesterday a little bit about that. And so we're bringing it forward today. So welcome, Kate.
Thank you. Thank you. Yeah. I think in the back of my mind, I'm always thinking as soon as we say that word, half the people shut down. And
Yep.
they're like, nope, we're talking about death today. No, we're not. You might be, but I'll be exiting now. And I think that part of what we want to talk about as we talk about this today is just looking at that, right? And having an honest conversation. One thing that you and I have talked about is what I want this to feel like is that recipe blog where you're like, just tell me how many cups. I don't care why you bought the farm. And you're scrolling to get to the piece of like, but what is it? So kind of trying to cut through to the topic itself
Mhm.
and shed what light we can through both of our shared experiences, which, mine is clinical and personal. And yours is personal, spiritual, lots of things, so that's our hope, right, is to just take you down the rabbit hole with us, but to some facts and some actual recipe versus just the fluff. Yeah.
And to
So where do you
demystify it.
a little bit, right? Like I think that's the thing is people hear that word and they shut down. And rightfully so. There's a lot of fear around death. It's not everyone's favorite topic, and everyone has a different experience with the whole process. And so, yeah, I think where to start is always hard because there's so many avenues to bring you to the meat and potatoes.
And that I was literally thinking about that this morning because the second you
Hmm.
say death to your point, people do shut down because they're like, I don't want to talk about it, I don't want to face it.
Hmm.
And people take it to the very literal meaning of death. And then this
Yeah.
morning, as I was reflecting on this, where my thoughts were is that we experience death every day.
Hmm.
The conversation I had this morning, which was a fabulous one, and it was a business call that I
Hmm.
had, that is now over. And
Hmm.
there's a new period that is beginning as a result of that conversation. There is a death to one end. Now, that is something that emotionally I'm not feeling to the extent of my father passing,
Right.
but it is still death. You and I were talking just briefly before we started recording about what our kids went through who were seniors in high school during
Hmm.
COVID and at
Hmm.
2020. The high school experience into the college experience, COVID or not, is a
Hmm.
death of one era of your life.
Hmm.
We
Hmm.
experience it within our jobs, a death of a
Hmm.
role, like, or
Hmm.
moving on from one experience to another experience. So that to me is part of that demystification, that if we use
Yeah.
the word death to anything that triggers a change,
Hmm.
unexpected perhaps, or
Hmm.
expected, it's still a change and there is still coping mechanisms that go into that. So for
Yeah.
me, it's that, at least to me, it's a
Hmm.
starting point around it's not as scary when we talk about it
Right.
that way.
Right. Well, and there's that element of what we all like kind of universally as humans, and some of us more than other, and I'm guilty of the more than other part of that, is control, right? Like we want to be the masters of our own destiny, our own fate. And we're very, very good at kind of packing away the reality that there is an end to all of this, right? And each time there is an end, I feel like to anything, like you said, you graduate kindergarten or college or move jobs or whatever it is, you've stopped being one person and begun being the next person. There's a new iteration of yourself throughout every phase of life as you grow, whether you acknowledge it or notice it or not, right? Like we're not all like, ooh, I'm a new person today, but it happens. And I think that how you respond to that is really closely related to your general fear of change and loss of control. So in what I do as a nurse, I've been just immersed in death and dying, which, you know, will is takes people back a little bit, and they think, boy, you just wade in tragedy every day. How do you do what you do? What an angel, all these other things. And I'm just always like, well, yeah, but no, I go to work. I like a paycheck. I am paid. I'm not a volunteer. And most of what I do in the clinical sense is anticlimactic. It is, there's very distinct types of this. For me, it is there's a life that ends in death, which all of them do, but you finish your life. It's complete. There's really nothing left to do. You know, whatever is done, and there's just, you hit 80, 90 years old, you talk to somebody of that age, and they almost universally are like, yeah, whenever I'm good to go when I'm good to go. That person's death is different than someone whose life is interrupted by death. Like, am I afraid of the eventual end of my life being death if I can get to 80, 90 years old? No, I can genuinely say that. Am I terrified as any human would be of my life being interrupted in death without my say or my control by either disease or injury or whatever? Yeah. And anybody who says they're not is lying. you know? And so that's the thing I think we want to dig in on a little bit is like, there's a difference there. And whether it's you looking at your own mortality, which is people's, in my experience, least favorite thing to do, or you're looking at your parents' mortality, or your mortality as a parent as it relates to your kids, where you're like I'm not okay with my kids dying, but I need them to be okay with me dying. Well, let's never talk about dying. And I know my parents are going to die, but that's, and there's this big generation of people out there right now that are dealing with that shift of, oh boy, here it comes, and we've never talked about it, with the expected death of their parents, where it's like, I can't wade through all of this fear that's attached to just the word to say, okay, but this is natural. This is I'm closing my eyes, hoping not to wake up in the morning natural, right? And those people are who I really would like to touch. I mean, everybody, but people who are like, but I really need to know what the next 10 steps are going to be, because my mom's needs assisted living. What is that? My dad has dementia, but so does this guy's dad, and they look completely different. And all of it in the background is the noise of death. And how do you ask? You feel like a callous asshole if you're like, well, how long is this going to take when somebody gets diagnosed with dementia? But it's a natural thought. Yeah, you can put yourself in those shoes and think, oh dear God, if that were me, I would like 10 more minutes of life and then get me the hell out of here. But then we can't transfer that to the person that we love because it feels callous to be like, oh, well, we have to keep doing these for them, because we never talked about it, and we're guessing and desperately trying not to look at where that's going. I'm going to call it dementia, but not death. I'm going to call it, congestive heart failure, but not death. And call it all these things that lead to people's natural end of life. But they have a diagnosis, and we never give them that diagnosis of mortality that we all have, but we just don't ever talk about it. So yeah, I'm excited to kind of explore.
Definitely. And what you're talking about, I think that there are two different paths. There's one, the people who are not directly impacted by death itself at this moment, but it's our parents or it's someone within our circle who's being impacted because of a diagnosis.
Right.
So for them, it's yeah, what comes next, how long, it's end of life planning. There's
Mm-hmm.
in my family, we've had these conversations for a variety of reasons.
Yeah.
But tangentially, assisted living, how much does that cost? How do we plan for that? And the great thing, well, great, and I'm saying that incredibly sarcastically, is that people don't understand how much it actually costs to go into a really great assisted living facility or senior
Yes.
facility, to the point
Mm-hmm.
where if you have investments, you hand that over. You have a
Yep.
house, you hand that over to pay for it until that time when that investment no longer exists, and then the money switches over to Medicare, or and you can speak to that more
We could
accurately.
do 1,000 episodes on how I feel about that.
Well, and we will need to, because that's a whole separate can
Mhm.
of worms with it. But people don't think about end of life planning because it's death. It's
Right.
attached to that. And I don't think I'm going to live that long anyway. So maybe my insurance will cover whatever, and then we're
Or I
done.
have made everyone promise they'll never put me in a home. Oh,
That's a whole
like,
5
yeah.
episodes of
Mhm.
how, why, and
How do you navigate that? Yeah.
and not pay for it, pay for it. Like I want to die at home. That's a separate conversation too,
I
of like
want
what's
$1,000,000.
feasible.
Like,
Exactly.
equally hypothetical if you don't have a
Well,
plan.
and so that's the planning component of it. And then
Mhm.
there's the, what does death look like and feel like?
Yeah.
Everybody
Mhm.
wants to know, like people in my life, because of some of my abilities or gifts, what happens after we die? I want to talk
Yeah.
to whoever's gone over. What does it look like when we die
Mhm.
after?
Mhm.
It's different for everybody. And
Mhm.
I know that's going to be shocking to some people who picture white
Mhm.
clouds and God's
Mm.
voice, light, and
A little
whatever.
harp. Yeah.
It's, but there's a whole bunch of other things.
Mhm.
Everybody is curious about what happens next.
Yeah.
The death part of it, how do we get there? It's kind of like, for I think about it as getting a license to
Yeah.
a car. It's like it's another phase of your life, and you've got to go through
Mhm.
it. You got to you have to pass the test to
Yes.
get there. That's, to me, that's death. But what does death look like and feel like? Because nobody wants to feel pain.
There's the question. Yeah.
So,
And that's what shuts us down.
Nurse Kate,
Yes.
maybe we
What's it
start.
look like? What's it feel like? I don't know what it feels like. I can take an educated guess though. The thing about it is when I in my time as a nurse in hospice, um I've had the opportunity to have some really straight up conversations with people who are facing their mortality. By the time you meet this nurse, you know basically where you're headed, right? And you know, one of the things I ask people if I can speak to them if they know this is coming is when we dig in on the concern, right? Like what do we need help with? Is are you afraid to be dead or are you afraid to die? And that's a distinction. And I didn't really realize it till I started doing this work of like, and the almost universal answer of people who are just, this isn't a tragic life interrupted. This is just the next thing that happens to me and I accept it and I know it and I don't have anything else on my list. Either I can no longer attempt the things that are on it, or I've had my kids, I've had my marriage, I've had my house, I did my job, I did, I've done life, and there's no life beyond 85, 90 that we plan for most folks, right? There's always exceptions. But when you ask somebody who's in that state, that question, almost without fail, the answer is, I'm afraid to die of that process. I'm not afraid of being gone. And they'll say it just like that. I'm not afraid of being gone. I'm afraid of that moment. And that I can deal with, right? Like that's perfectly rational and reasonable. And I think the thing for people to understand is like death can be kind of boring, especially an expected death, right? Like, especially a body that is just naturally shutting down. That's natural, right? Your body's prepared for it. Your body is leading the charge, and it's anticlimactic. It's all get out, right? We're a lot of times I'm just a passenger for that. Of like, yeah, I can help with some pain because you're not moving like you did, or things can be uncomfortable physiologically,
Mhm.
but it's wildly anticlimactic, right? I think we built up death to be this big, like, ooh, all these, either this big bright white light's going to come and the angels are going to sing and everything's going to be amazing, or this big creepy, thing I wasn't expecting is going to come in. And most of the time, it's just Tuesday. And there's not a lot more to it than that. I mean, there's some pain for sure, but it's such a manageable amount of pain for most people. What happens is when you lose that mobility, but we're talking like the last few days, hours, minutes of death can be moderately physiologically painful. But is your brain present for that? Is your body active in that? Those are all things that, like, on the minute level, we can talk about, and that'll take more steps for sure. But like a normal death that is supposed to come is pretty boring and good. It should be boring, right? And the thing about it is like in the society that we live in today, every ache and pain has a match. Every problem has a solution. Every illness has an intervention, right? You go in, if you work in a hospital or you're a nurse or a doctor, you know this very much. It's problem intervention. And you have to say, and there's this little thing in the back of your mind that says, if I identify a problem and I don't attach a solution, I will get sued. Like, so our whole medical system is taught to say, I've identified a problem and here's my intervention. So you can't sue me for that problem. And that's part of the greater narrative of that'll help my patient, it'll fix blah, blah, blah. But problem intervention, step one for all of healthcare. And until you get to hospice, and then it's like, problem, yeah, we've got those. Unless that problem is pain or discomfort, we're not intervening because the body's on that path, right? And I think that's some of the mystery of it, right? Like a death for a body that's trying to live and has more life to give, traumatic, young, some of those things, that is a whole different topic, what we're talking about, but we lend ourselves the fear from that topic. We're like, all death is terrifying and all death is tragic and all death is off limits for me to talk about because I'm afraid to think about it for myself, for my kids, for my parents, for my friends, for everybody. And I think that is one thing that we have to start saying is like, ask those questions. What's going to happen if they can't get out of bed? What's going to happen if they don't eat? What's going to happen if I can't quit my job and become a millionaire and sit bedside for every second of that? Am I going to go to hell? Am I going to be the worst daughter ever? Are they not going to know I love them? What happens if I'm their only person and I don't love them? And they weren't good to me. And the people still call me thinking everyone loves their mom. This is your mom. How do I navigate that? And if you can't even ask the questions about death, all of a sudden whether you like it or not, you're going to be in the middle of it with no information. So that's, I think, the beginning of this conversation is let's just skip to the recipe, ask the weird questions, and let's talk about it. And so that's what we're kind of hoping to get to.
And I would love to either get questions from people who are watching and
Mm-hmm.
send it to you and me so that we can address what else might be out there. Because you mentioned earlier, like, there are people who, if they say they're not afraid of dying,
Mm-hmm.
I fall kind of into that category, but that's because I grew up with death ever present. Like
Mm-hmm.
my first memories as a kid was my family honored my older brother who died a day after he was born.
Mm-hmm.
My dad's parents died when he was a teenager.
Mm-hmm.
So death and honoring life and the living and the deceased was just a
Mm-hmm.
natural part of my upbringing. So
Yeah.
we talked about it. I was curious. I
Mm-hmm.
didn't understand it. I wanted to understand how they died and why they died and what led to all of that. So because it wasn't a taboo topic, I was like, well,
Yeah.
life, you live, you die. It doesn't
Yeah.
matter how old you are. It can happen, life interrupted, as you said.
Mm-hmm.
It can be something that's tragic
Yeah.
or it's a natural cause at any age. My
Mm-hmm.
grandparents were young by today's standards, really
Yeah.
young.
Mm-hmm.
But it was natural because of their health issues and what they had going
Mm-hmm.
on. So then as I got older and we were in high school and there was a classmate that died. She was in a
Mm-hmm.
horrific car accident and thankfully she died instantly. But she went
Mm-hmm.
through death. And then I started as a teenager thinking, like, what did she feel? What was the
Yeah.
horror in the moment when she saw that there was a head-on collision about to happen?
Mm-hmm. Yeah.
That's not something you and I are going to solve today, but for me it was
Yeah.
like steps throughout life and then
Mm-hmm.
my own things psychically. Like I had a vision when I was a kid of when that was going to be,
Mm-hmm.
and I've lived my life making sure that I had no regrets. So I had
Right.
someone talk to me recently about my current health situation. And I
Mm-hmm.
told him, I was like, I've lived everything that I thought I would. And
Yeah.
then, and
Yeah.
done everything that was on my bucket list. And he's like, but you didn't do
Exactly.
this, and this. And I'm like, that's your bucket list. Like, if I
Mhm.
have time and my body can keep up with it and I've got the financial means to do so, maybe. But I have other
Right.
things that are on this extended portion of my existence to do. But
Mhm.
time I'm looking at, well, if when I die, what does that look like for my family?
Mhm.
Am I scared? No. No, because I
Yeah.
have you. I ask the questions of,
Yeah.
what does it look like? What does it feel like? And I did actually almost die a year ago. I felt life leaving my body. I felt that
Mhm.
process. I saw myself go unconscious. And thankfully, I was surrounded by nurses because I was in my oncology office, infusion.
Mhm.
I,
Mhm.
I came to with 5 nurses bringing me back to life. And thank God
Mhm.
that it happened then, there,
Mhm.
and all that. Had I not had that experience, I would actually be afraid. I now have a at one experience that is a possible feeling of
Mhm.
physically what you go through when the body starts to shut down. And first it was mouth, like the words weren't coming out,
Mhm.
right? I was still thinking clear as day here, and I was
Yeah.
processing the shit, something's really wrong, and I'm slowing down. And then the
Mhm.
vision started going, but the brain was still working. So I could
Mhm.
feel the senses going and
Yeah.
that process. But that is one, there are 8 billion people on this planet. That is
Yeah.
one kind of little
Yeah.
experience, because clearly I'm here. I didn't die.
Yeah. Yeah.
Anyway,
I think that's part of the problem, and it's part, not the problem, I guess isn't the right way to say it, but like, when you say, "Am I afraid?" and then we take that little pause, I feel the same way. As someone whose, like, whole life had death was never taboo. It was never something we couldn't talk about, right? Like, it was just but it doesn't mean that as a kid I was like, "Oh, that's fine. You'll die."
oh,
I
agree.
absolutely I think I don't wanna diminish the fact that, like, I had the same terror of death as everybody, as a when you realize it's a thing when you're a kid and you're like, "Wait a minute. Is that gonna happen to me or my
Yeah.
mom?" Or, all the things you worry about, and, like, there's always you're always riding that edge, right? But at least you're thinking about it, and you're aware of it. What I think most people do is, like, they put that fear in a box, and they push it as far away as possible, and it creeps into things, and they don't even notice it, right? Other things are ending or representative of death, and they're like, "Oh, but that's just, I have anxiety about that, but not about death." And it's like, but do you though? And where we've kind of failed as a healthcare system in this is there's no system for it. And it makes the way that our for profit healthcare system works doesn't work for death. Because as many times as I've been a part of someone's dying process, I can only give you educated guesses and facts and support, but everyone's death is different. There is no this, and I will say this to people, and because it's true. I do death, absolutely. I've never done your death. So I don't know how it's supposed to go. All I know is I can keep you comfortable through it, that we've all agreed it's coming. and and it'll be okay. But what I do know without a shadow of a doubt, and I have witnessed, and I didn't know this until I started doing what I do. I wasn't always a hospice nurse. I'd done regular nursing and, hospitals and all that stuff. And what I didn't know until I started doing this was I've never seen this not be true. So, fair warning, you absolutely die how you lived without question, and you can't avoid that. So, if you're afraid of your process, if you're afraid of, like, oh my God, what's going to happen to me? You can draw some conclusions, right? If you're a standoffish, cantankerous, just isolated human who has had a difficult fight of a life, heads up. you know, if everywhere you go, you struggle to interact with people and you struggle to get where you need to be, heads up. If you are walking through this life working on yourself and trying to do your best and just being as good as you could be, right? Like, you don't have to be perfect, and no one's perfect. But, when you meet a family and they're like, "Oh, my mom doesn't talk to these 3 sisters or these 2 children, and she'll talk to us Tuesday, but not Wednesday, and blah, 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 blah. And if we say this wrong, we'll all be in trouble." I'm preparing myself for a very difficult passing because that's the way that life went. If I go meet you and you're like, "My mom, God love her. Here's every kid she had. Here's every neighbor she's ever met. Here's every school kid who ever walked past her house," whatever it was, then I can take a deep breath and be like, "Okay." Then I can expect that to have impact on your death, right? But if you're in the doctor's office or the hospital, the there is no time, and it is the wrong thing to do because you don't have time to dig into it, and it's not your scope or whatever you want to call it. Just say, "Hey, how are things? How are you feeling?" Like that's the wrong question, but it's the right question if you're taking care of a person. And so I think that's part of our problem too, where everybody's death is a little bit different. Why are you dying? Is it your heart? Is it your lungs? Is it your blood? And there's 100 different reasons why. And each one of those is going to look like a little bit different physiologically. And then it is, when are you dying? Who are you dying with? Why are you, all of those things? And it's too complicated to put into click boxes in
Mhm.
an epic charting system. So we don't talk about it. Instead, we say, your heart's failing, it's beating. I don't know how you're alert, how you're even awake with every test I can see here, but I'm going to choose an intervention for it. Instead of saying, at some point, your heart's going to stop. We don't say it anymore. And so patients go in thinking there's always something we can do. So I will meet people whose doctors have told them there's nothing else we're out of treatment options. And that in the doctor's mind means I've told them they're dying. And I'm actually the first person who has the gumption, to say the big word, "You're dying." And the shock and the relief of like, I thought so. They said this and this and this, but no one ever said I'm dying until they meet and then like that's part of the problem is we support the put it in a box and don't look at it during medical care of like, well, we could always do something. Take this medicine. Here's a prescription. Here's a scan. You're 95 years old and you have metastatic cancer. But here's an intervention. Try this, this, and this. And the system makes it easy, and it's part of where you start to lose people in healthcare, where that moral injury of like, I don't know why I don't like my job, but I don't like my job, you know? So the rabbit hole is big on this one.
Well, you're right. And there's so much, because if we're looking at it from a clinical system perspective,
Mhm,
that's one, like your checkbox example. I mean, it's so on par with my personal human experience of it. But then there's also the psychological factor of
mhm,
how is the system, for whatever reason that it was set up the way it was.
mhm.
Medical care is business,
Yeah,
right? So they're trying,
we're
yeah,
all
and they're trying to do XYZ to fit in
Mhm,
there, mitigate risk and all of that, all the businessy things that go along with it, but it's
mhm.
directly impacting the human. And
Yep.
that human that is being impacted has a psychological or emotional response to whatever is happening. So if a doctor
Mhm,
is not saying we're out of options, or here are your options, here are the
mhm,
consequences of those options based on
mhm,
your age, your
mhm,
physical situation, blah, blah. This is the potential outcome. Here's your choice based on
mhm,
what
mhm.
you would like. Or here's your life expectancy based on what I'm seeing and what my experience is. Those conversations, to my experience, don't happen. I've got a bunch of friends in the medical community who can validate or not what their
Yeah.
experiences are in that. All I know is like what my dad went through. And I talked to you about this a little bit, but
Mhm,
for everyone else out there, my dad's last, he was in and out of the hospital for years. His last stay was a year ago, and he had a blocked artery. He already had a stent put in place. His body could not handle surgery, pacemaker, like anything else.
mhm,
And the doctor just told him and my mom basically, well, there's really nothing else that we can do. They asked, I
mhm,
believe, for a second opinion and whatever. My dad was on borrowed time.
Yeah.
Doctors weren't saying, look, this is a no. Your
Mhm.
age is this. Your health
Mhm.
conditions are all of these things. So based on
Mhm.
these factors, how about you go home and you enjoy whatever time you have left.
And
If
they
that's
never said it. Yeah.
no, they never said it. But to my
Mm-mm.
dad, he was like, I don't give a shit anymore. And you guys are like, you're poking me and prodding me at 3 in the morning. You're
Mhm.
bothering me and I'm not getting rest. You're telling me to rest, but there's nothing really you guys can do for me.
Yeah.
So why am I sitting here? Why am I
Yes.
laying here helpless?
Yeah.
So he literally checked himself. He called my mom and said the doctor released me.
Mhm.
Mom shows up at the hospital and they're all like, what are you doing here? She's like, I came
Mhm.
to get my husband. They're like, why? Well,
Yeah.
because you guys released him. No, no, he can't go
He
anywhere,
promoted himself to doctor.
which is very much like my dad to be like, I want to be on my own terms. If I go home
Mhm.
and I die, I die.
Yeah.
And he took on that responsibility, but the doctor didn't have that conversation with him and didn't give him the choice. He would have
Yeah.
died in the hospital, or even if he would have
Mhm.
gone into seizure, cardiac arrest, or whatever the clinical terms are for all of that, would
Yeah.
he have survived or would he have lost brain function at that point because his body was shutting down? Everybody
Yeah.
knew it. The organs
Mhm.
had already gone through what they could. He
Mhm.
chose to go home and he
Yeah.
died a few days later, but he died at home.
On
He got
his
to
terms.
say goodbye to my mom. Literally, he got to
Mhm.
say goodbye to my mom. He didn't know he was going to die, but maybe his soul knew and influenced it. She got a last moment with him that she
Yeah.
wouldn't have had if he died in the hospital. So he died on
Mhm.
his terms.
Yeah.
He made life a
And he
living
died
hell.
how he lived, however the hell he
Yes,
wanted.
exactly.
Yeah.
Thank you, Kate, for bringing him here today, because that's exactly who he was and how he was.
Yeah.
And it it is just that he died how he lived, and he
Mhm.
died how he wanted with the woman that he spent 50 years with by his
Mhm.
side, instead of having doctors surrounding him and trying to bring
Mhm.
him back to life when there
Mhm.
his quality of life is a separate, that's a whole separate topic. How do we define
Yes.
quality of life? But for him,
Mhm.
someone who was active his whole life up until the last like 6 to 10
Mhm.
years, like there's a decline,
Mhm.
which separate rabbit hole, and maybe to bring us out of this death conversation, because people out there are like, I can't believe she's talking about this, and oh my god, I don't have a problem talking about it. I might start crying, but I don't have a problem saying it,
Mhm.
you
Yeah.
know. It's the quality of life.
Yeah.
I'm not going to reveal your age. My age, I've had
It's
four
okay.
plus decades into all of this, right?
Yeah.
Every decade, I remember thinking once I hit 11, 12, and your body is going through certain changes, I was like, this is different. I didn't have
Mhm.
that before. I don't really like all of what I'm going through right now. And then
Yeah.
I hit my 20s. And then there
Mhm.
was another change. And I'm like, wait a second, I don't have the energy that I used to when I was in my teens
Mhm.
and I had my kids
Mhm.
too. And then I hit my 30s and then all kinds of shit started to break.
Mhm.
Like, why? Why is all of this
Why are you
going
giving up on me,
on?
buddy? Yeah.
You know, but the death process,
Mhm.
we're dying after we're born. Like that, you
Yes.
said this to me before, but it's
Mhm.
this, I can't cheat death. And my
Mm-mm.
body is naturally going through whatever it is going through for my unique experience and my health situation. And I've noticed this for decades, how
Yes.
it's just working towards the natural outcome.
Mhm.
So the question for me at this point is, for the people who are like, I'm going to get healthy. I'm seeing all these ads for, sorry, I will stop talking. I'm seeing
It's
all these
January.
ads
No, no, no.
for
Yeah.
healthcare. Like I want to do like this diet, because it's January right now. So like
Mhm.
I've got to drink this green powder juice that looks so bad that they're advertising right now, right?
Yes.
You know, and I've got to eat this and do that. Well,
Mhm.
how about we live our life in balance?
Mhm.
We're dying every day. So
Yeah.
instead of using up all my years in a year,
Mhm.
how do we live so that
Right.
our dying process is on our
Mhm.
terms?
Yeah.
And how, like, I don't know,
Yeah.
maybe that's our next topic, like, or now, how do we do that, Kate?
Yeah. Well, if you're afraid of death and we know we can't cheat it, only thing you can do is work on how you live. That's the control. Everyone wants that piece of control, right? I just told you as someone who's seen hundreds of deaths, right? Um, that the piece that you bring into it and that you're in charge of is you. Who are you? How do you show up? What do you do? If you're scared of death and you're going through life in a way that is difficult and you're in your own way, you're going to stay in your own way. You know? So if you people want that piece of like, well, I can't do anything about it, so I'm not going to think about it, which I consider to be completely untrue. I mean, can you do anything about the fact that you're going to die? No. Can you do anything about how you die? Uh-huh. Lots. It's work that most people don't want to do. It doesn't involve green juice, you know. It involves like work on you as a human, which is harder for most people, right? Like I'd rather drink the green juice than look at my faults in the mirror, like anybody would. But I think you bring up such a good point with your dad too, as far as, and this is something that I think would resonate with anybody in healthcare who has ever done anything, right? Like we all go into the hospital thinking, here I go, healthcare hero, check me out, you know? And then you get there and it doesn't feel like that at all. It feels, and the separation of, and there are moments, right? Like everybody has their moments of like, I caught this, I did this, I made a difference, blah, blah, blah. But so much of it is Tuesday, you know, and not interesting. And you're so much a cog in a system of only an RN can click this box. So you're hired to click this box. You're not hired for your opinion. You're not hired for your skills, even really a lot of the time. Only an RN can click this box. So click this box. And that applies to every specialty in a for-profit, which all of it is, acute care system. Whether you're, I mean, when I say for-profit, I mean all of healthcare. I don't care if you're a .org or whatever, you're all making money. and all of your care is based on profit. It just is. And it is, I think the best description of it is there's a big hospital downtown Denver. I live in Colorado, right? And on the side of it, there is no joke, probably 3 stories high picture, like banner. And it has a flatlining heart rate on it. And then like a doctor fully with like a hand held up of like, not on our watch, no one's dying here, right? In this massive healthcare center, right? Which I'm sure whatever marketing person came up with that was like, yeah, that's right. Come here and we'll save your life, right? And what I think everybody who works in that building, whether they know it outwardly or not, knows on a very real level is 90% of the people in that building, whether it's in emergency or in whatever unit they're on, are over the age of 70. And we just gave them a 2-story banner that says, you're never going to die. For the 10% that come in for trauma and young, and you know, we are going to stop you from dying, and we should do everything that you had in that moment of like, can we bring you back because you're not done, we don't want your life interrupted. But the biggest message we're putting out to everybody who walks through our doors is no one dies here, because in the hospital death is failure, and we don't do it well in the hospital. We don't talk about it, we don't address it, and we force patients to advocate for them or their own death, like your dad, you know, and 90% of those patients are doing what the doctor says and staying in the hospital. So they'll die there. They don't get to go home and have that moment with their wife. And if they do, we are forcing the patient to say, stop it, let me die. Quit intervening on the things I'm telling you I don't want fixed anymore. What do we have to do to somebody to push them to that space where if you just asked the first doctor who admitted him the first time that year, what do you think this means as far as death? Your opinion, not what interventions can you do? I promise not to sue you if they're going to die. Look at me, look at myself, and tell me, do I have just 1 year left? And if that doctor would have been able to be themselves and able to think on that level, I mean, I think they all are able, but it's just not encouraged. And there's no time to stop and think about it that way. And I think any doctor could look at most people and say, yeah, I mean, you're 80, you're whatever, your heart's failing, your lungs are this, you're on borrowed time, and give that patient the option. Some of them do want to come back every 6 weeks, like clockwork. Keep me alive as long as you can, doc. But so many more people that I have met will say, oh, If this is it, I'm never coming back here again. I'll let it all lie. But they instead force it until there's days left and you have to leave feeling like you failed. Rather, and the hospital feels like, well, he left AMA, and he's gonna die, and that's his fault. Because the fault needs to be attached to all death right now in healthcare. Whose fault is it that they died? You can't fix 85. You can't fix 90. There is no intervention for that. And we just blatantly ignore it in healthcare. And it's so, it just is such a disservice, right? When you talk to healthcare folks, like part of my job has been hiring nurses to come be hospice nurses. And there's nobody easier to take than somebody who's worked in the hospital, especially if they worked in the hospital, a place where people normally die. So an ICU nurse or an emergency room nurse. So easy pickings to come and recruit for hospice, because all I have to say is, how many of your patients that are in your ICU bed, intubated, tubes everywhere, in their 90s, everyone knew, we're all standing there thinking this is futile care. This is coming whether we do all this or not. We're dumping all of these resources into this person. They don't even know what we're doing. And now we can't speak to them. And then watch them die. And everybody treat it like, ooh, and we treat it in healthcare like, ooh, yeah, well, that'll happen. But if you could have met all of those families 6 months ago and said, hey, we all know your heart's going to fail eventually. We all know, I mean, don't stop treating it till we get there, but we all know what those signs are. And been able to say, it's okay to not come, get help elsewhere. Like, we don't have to intubate you. Please don't believe television CPR. If you want CPR, I feel like everybody should have to watch a video of real CPR on a 90-year-old. and then say, yes, please, I'll be a full code. And if you can't get through the whole video, you can't be a full code.
Like
But I
everything
mean,
you're saying,
yeah.
like there's an opportunity for the healthcare system and what you just said to enhance their services. This is a
Mhm.
whole other team that can come in case management and intake process, add on some lawyers and whatever else. Like you've got a whole new business development
Mhm.
opportunity. Sorry, this is the business consulting side of me stepping in, but
Yeah.
it's like there's a need for both
Mhm.
patients and then the healthcare teams to have what they want
You would
and
think.
what they do
Yeah.
best. If you've got doctors and nurses
Mhm.
and medical staff that have thrown themselves into healthcare, this is what they want to do is to help
Yep.
people. And then you're
Mhm.
telling them, don't open your mouth. No, don't say that because legally
You
we
don't
can
even
get
have to tell them. You're just teaching them. Intervene or be sued. Intervene or be sued. Intervene or be sued. You don't even have to say it. That's the beauty of it from a
but
business perspective.
from the patient perspective,
Oh
to
yeah, we
bring
don't think about
in
that one.
have a lawyer come in and sit in the
Mhm.
call or whatever, like, but the intake
Mhm.
nurse to be like, what is it that you want for the rest of your life? How do
Mhm.
you want to live on your terms? You want to be
Mhm.
150 years old. And okay, we know that that's not going to happen. You want to hit 100. So how many times do you want us to resuscitate you? How many times do you want to go through this? And each time you're going to lose function.
Yeah. And
This
also,
way,
every time doesn't work. You know?
to
Just
have
because
that
we do it doesn't mean you live through it. Yeah.
to have that conversation and then with their loved one in the case where you have a partner or spouse or children
Mhm.
who want you
Mhm.
there, who are you living for? Are you
Yeah.
choosing to live for yourself or is your family choosing for you because they don't want to let go? Again,
Mhm.
having it's
Yeah.
death does do exist and
Mhm.
there's an opportunity here for that as well to talk to family
Yeah.
and for the patient so that
Yeah.
everyone can decide well the patient should be able to decide for themselves first off
Mhm.
but also like what does that look like how do I want to live and this
Yeah.
isn't just for old people we've got
No,
to stop thinking that
everybody.
death is for the
Mhm.
old
Mhm.
because we all have life expectancy stuff, but
Yeah.
I know how I want to die on my terms. My
Mhm.
doctors don't talk to me about this stuff.
Mhm.
So
Mhm.
I'm pushing.
Yeah.
Like I want to try this. It's not a cure, but I want to go down this path. I can't have that conversation because there's no time. And if I'm not
Mhm.
taking X pill every day like prescribed, then I'm not following doctor's orders, but I'm taking on more risk by taking the pills that they want me to take than trying this
Mhm.
homeopathic thing that also helps. It's it's so
Yep.
irritating. I'm at the
Yeah.
point where I'm like, I don't want to go to the doctor anymore.
Yeah.
I would rather just see how this plays out.
Mm-hmm.
And I'm 40
Yeah.
plus years in. So
Mhm. I
anyway,
feel like it's dirty little secrets time, right? Because when you say, like, from a business perspective, um, we should do that. But that is only if what we want to be true about healthcare was actually true, which was that we're taking care of people. And I think nobody knows this or feels this more than people that are working in our systems right now of like, why don't I like what I'm doing? I thought I would like it so much and I don't. Most of them, they're doing good things, they're doing good care, and it isn't an outward thought or an outward conversation of I'm not addressing that. And it's the dirty little secrets part of the healthcare, especially acute care hospital stuff, is they never had to say that they had bad intentions. And honestly, I don't even think anybody who would be on the business side of it would say, well, we set out to be this thing, right? Like if you listen to business people in hospice, or not hospice, or healthcare, they all say the same thing. Oh, we're patient-centered care, we care about this, and they mean it. They're not all evil villains,
mhm.
but they also are like, but we have to be, good with our resources and all those things. And if you've ever worked in a hospital, I'm about to say something very triggering for you because we've all heard this. It is, they compare themselves a lot to the airline industry. And they do it in a way that it really hones in on what most healthcare people are trying to take care of people. And it's very effective. And they say, how rare is a plane crash? And look how safe they are. Look how safe they are. So we're just trying to figure out, how did they get so safe and we still have all these medical mistakes? How did they get so safe? And as a healthcare employee, like, I personally drank that Kool-Aid for sure. I was like, yeah, I want to keep everybody safe. Sure. Like, that's normal. But then when you look at it, it's like, also what that gave a permission slip for was everything is a procedure. There is no independent thought in that system. And that's an airport. Here it is, black and white. Check, 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 check your boxes, do your thing there. But it's a machine, not a person. There is a very black and white way to go through that. You don't have to ask the airplane engine if it's having anxiety. Do you use illicit drugs to the engine wing? You just have to check the boxes. Do you feel safe at home to the tires? No, you don't have to do those things. So it's never, after stepping away from acute care, I look at that and kind of laugh at myself for being like, oh, cool. We're about to be as safe as flying, just completely naive. But it was like, it ties into that thing of nobody started to be a nurse or a doctor or even an administrator in the hospital or business side of hospital thinking, I'm about to just screw over every patient in healthcare, right? But that doesn't mean, just because you didn't mean to do it doesn't mean you didn't do it, right? Or that you didn't. What we should be focusing on and aren't is putting effort into not doing it, right? Because it will happen in profit driven care, like, organically. If everything's a checkbox and every intervention I can click, and none of them have anything to do with saying, stop, this person's 95 and has this and this, did we have a conversation? And they're never going to bring in the group of people a year ahead to say, how do you want this to go? Because the reality of it is, one, what if we get sued? And first thought. And what if they die and we didn't document it right, or whatever. Two, and they miss out on a year full of hospitalizations that were appropriate, that Medicare said they'd pay for, that insurance said they do, and for the healthcare people, like, they're doing a good thing. You do have a problem. I do need to intervene, right? And the question that they don't have time to ask themselves is this person uncomfortable with them dying, or am I uncomfortable with them dying? Right? Because, and for a million reasons. I don't have time to talk about it. I don't want to get sued if it happens. It's a pain in the ass if somebody dies in the hospital and we weren't planning on it. It'll really ruin your day. But, like, to say that as somebody who went into this wanting to help people, it's the things that we don't even turn in on ourselves and really think about, right? So, I mean, 3 sentences to anybody working in acute care, and I can shift their whole focus to, like, oh yeah, I don't want to work here. Not anybody, but a good chunk, right? Like there's so much broken behind it, but it's a really long-winded way. I'm sorry for saying, like, all of that is this message to the people who need us to be there, who we are their 911, right? And when that message is a big stop sign to a flat line for everybody who walks through our doors, even though everybody who walks through the doors, from the people who clean the rooms, people who cook the food, to the people who run the insurance, the doctors, the nurses, the patients, they're all going to die. The biggest form of false advertisement under the sun. They literally just told you in a 3-story poster that we can do something that no one can do. And we shut your avenue for saying I'm okay if that's what's happening down to you literally shouting for it. I don't care that you can intervene, let me die. I wish I could say I was shocked or surprised by your dad's path, but I'm mostly excited because he at least took it in time to get what he needed, where most people don't.
He had the balls. His whole
Yeah,
life was that. He always did stuff.
happy
He'd be
lived.
like, "Oh, brick wall? Nah." And
Not
he'd
for me.
find his way around it. So
Yeah.
to this day, he's an inspiration for me and for a lot of people who knew him because
Mhm.
he wasn't afraid to ask why, how, and to say no.
Mhm.
Because everyone around him was like, yes, 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 yes. And he was like,
Yeah.
no.
Mhm.
Um, but you bring up, I mean, you brought up so many interesting points. The one where I think I want to focus, like, some of the time that we have left for this particular call is around kind of choosing how you die. And I don't mean picking like plane crash,
Yeah. Mhm.
but it's
Yeah.
the
I would like to be hit by a bus from behind when I'm 85, just if we're taking suggestions. I don't wanna see it coming.
yeah, just instant.
Yeah.
Um, it's this, we don't have a say in it because the healthcare system is set up the way it is for its own
Mhm.
reason. Separately, without going down this rabbit hole, but we know this to be true, is that if you are religious, the
Mm.
faiths define what you are really allowed to say, and heaven forbid it sounds like suicide.
Yes.
When you are 85 years old with dementia, no faculties, your body has shut down, you can't even swallow anymore to feed, and you have a feeding tube in you because 10 other people want you to stay alive. That when you tell
I
a
would
doctor,
add a caveat to that. 10 other people want you to stay alive, right? You have a feeding tube in you because we turned and asked people, "What do you wanna do?" without educating them, and we said, "Feed them or don't feed them." I mean, there's plenty of people who say it nicer than that, but ultimately, we put those last minute decisions in the hands of people who we've never talked to about it before.
and
Yeah.
I mean, this is also a legal process then too. What paperwork can we fill out for end of life planning? Goes back, do we die on our own terms?
Mhm.
It's that component of how do we tell our healthcare providers, just let me die. I want to know what you think should happen.
Mhm.
What are all my options?
Mhm.
And tell me what the consequences of those options are for the feed or not feed. Am I
Mhm.
gonna die starving to death over 15
Mhm.
days? Because I don't want that either,
Mm-mm. Mhm.
but if there's no actually, this is the answer, it's conversation. There's no
Mhm.
time because time is
No
money
time.
to
Yeah.
have
So
those
it's never
conversations.
gonna happen in our current system. Mm-mm.
So
Fun.
how do
Yeah.
we get out there? How do
Mhm.
we I was gonna say, how do we change? You, me, like you and me, Kate, how do we
Against the
change the
world.
healthcare
Yeah.
system?
One
Um,
person at a time. Yeah.
and one conversation at a time. So
Mhm.
here we are talking about dying
Yeah.
from healthcare perspective, from the scared human perspective,
Mhm.
and then from the, well, physical reality
Mhm.
perspective of it. So yeah, I'm not sure where we go from there because there's a flip side to all of this too
Mhm.
that I want to talk about in another episode that I'm not even going to say right now. But like the death and
Mhm.
dying process, what would you say to someone, to two people, someone who has lived a full life,
Mhm.
has a slew of medical problems, but doesn't know how to address this topic. So what would you say to that person? And then what
Mm,
would you say to that person's family members?
mm, good question. And what I think, what have I said? Right? Because this is
Yes.
something I deal with all the time. And it's there's two, so when that person already has their sort of medical issues and their family, I'm gonna put that in one box. But then the other person I wish I could have spoken to is them 10 years before, 2 years before, their healthy self, when they're not scared and they're not physically drained and they're not emotionally drained. That's when, like, and if you're one of those people right now, please keep listening. Because that for me is like, if one person hears this and thinks, okay, I'm gonna have a real conversation while we're not scared, and when I meet people and they're right on the edge of needing hospice, and they're afraid that if I say that that's what they need, that means they're dying right now and they better get busy doing it. What I always say to them is, you want to meet me as your hospice nurse before you need me, while I still feel like a choice, right? Where you're like, I'm choosing not to go to the hospital because it's not making me better anymore. So you want to meet me while I feel like a choice, because you will meet me at some point where I don't feel like a choice anymore. It's like, hey, my name is Kate, you're dying, here's your morphine, right? That is the thing. You can also meet me while we can have a conversation and you can tell me how this wants to go, how you want this to go. So that's what I would say to people before they get to this space, is start a small conversation, right? You have a friend that goes into the hospital, and just be brave enough to say to your spouse, to your kids, to yourself, if that were me, what would I want? You have a
Mhm.
parent that goes through something, have that space to give that permission. I can't tell you how many kids, they're in their 60s, 70s and making decisions for their parents, but your kid, they are your kid until you die, you know? And so you meet this human and we're guessing. Tell me what you know about your mom. What do you think she'd like to do here? Because she can't speak for herself anymore. So what I would say to everyone, especially someone who, I feel this coming, I have all these things going on. I'm putting these puzzle pieces together. My doctor's not saying the things, but also every time I go to the hospital, I don't feel better anymore. I feel worse because I spent my time there. But I can't not go because it scares my son if I don't go. But I never want to go there again. Be brave. Just a little. You don't have to say, here's my wishes and I wrote them all out for you. Just say, just start that conversation and give your family, if you're the person, the gift of not having to choose. Ultimately, whenever I take care of someone who's dying, or I train a nurse or talk to somebody about how to do this, I say every complaint, every concern, every phone call that I get in hospice is based in that person's fear of being why they died. So if I call a son and I say, hey, your mom's blood pressure medication is this, this, and this, and it's time to discontinue it. Are you okay with that? Do you mind if can I get your permission to, because I can't ask her, right? What I've done to this IT professional is say, we're going to stop treating your mom. and if she dies of something related to her heart, they're going to, what they're thinking is, what if she stops taking that pill and she dies? And immediately in that moment, almost without fail, people will forget that they're 85, that they have cancer, that they have dementia, and they will give themselves the full power to either have them live or die on one dose of lisinopril, because they don't know. And so what I always tell people is, it's based in that fear of, I don't want to be why. So reminding them, like, we're not choosing to not take care of you anymore. We are saying the body can't take this anymore, can't swallow it, or don't need it, not eating enough to have high blood pressure, whatever it is. Tell the truth of, like, the body made this choice. Are you okay if I stop wasting this pill? But if your mom had already told you, hey, if I don't know my name, and this is something I've said to my poor damaged kids more than they probably ever needed to hear, but if I don't know my name and you are managing my blood pressure, the first thing I'm going to do is haunt you. You know? Don't do that. Don't put yourself through that. Just stop. There's so many things we can do to treat my body, and there's nothing we can do to treat my mind. Let my body go with my mind. You're going to end up with a perfectly preserved body and a completely demented mind. Tell me one person who would raise their hand and say, I'll take that.
Mhm.
But if you don't, just say the little things. Start the conversation. Tell them what you want, even if it's hard. Find somebody to help you talk about it. Ask your doctor, and if your doctor does what some doctors do and is like, "Ooh, I'm not sorry. You don't need that yet. We'll talk about it when you need it." I can't even tell you how many doctors have told me as a hospice nurse, it's like, "Yeah, that your patient wants hospice. They are appropriate for it per Medicare." And the doctor's like, "I don't think they're there yet." Like, are you uncomfortable with death, or is your patient? Is your patient's good with it? You're uncomfortable with it. Like, separate that, but have those conversations. Just even the little every time someone's in the hospital, just be brave and talk about it. Every time you see we see it in movies and TV and life, where it's peripheral for a lot of folks. Just say what you would want. When that's my time, don't worry about that. If I need to go, it's okay. Which sounds easy to say, and most people think it. But man, there's nothing worse than having to guess. I feel the same way about feeding tubes as I do about CPR, where you should have to watch the video. For feeding tubes, I feel like any doctor who's offering a feeding tube, it should be legally required to have the conversation of, if I'm going to put this in, then we're going to talk right now with the person I'm putting it in about when you want it out and why. Because your body's trying to die and I'm stopping it with this feeding tube. And if we don't talk about it while you can talk, at some point I'm going to have to turn to your wife or your son or your daughter and ask, now do you want me to stop feeding him? And they don't do that, of course, because there's no time. Not that they're bad doctors, but problem, intervention, no lawsuit. It's a lot.
There's a clear role that's being defined in our conversations that would fill gaps within the hospital system.
Never going to happen.
That helps. Maybe you and I need to start a consulting company that helps for that. Just the tough conversations in healthcare that no one wants to have. And it's like, here's the reality and here are your options. And now you can go back and you can choose. But
they don't know we're not having them, right? I think most healthcare people would say, of course we are. But do you think your patient really understood that you have no treatment options? What's that mean to them? I've absolutely had cancer patients come on hospice and not realize it was hospice, thinking the doctors having no more treatment options meant there was nothing left to treat, that they were cured.
Oh my God, that's a whole separate.
More than once, more than a dozen times that has happened to me as just one nurse. Just the misunderstanding of there's no more treatment options. Oh, cool. No more treatment. Good job, doc.
Well, we're talking about oncology, and just to kind of like tie this up with a bow, to your point, the conversations aren't happening. They're not. I've experienced that. I went in, this was a year ago, went to my doctor, and the nurse practitioner who saw me in this particular appointment was like, well, have you gotten your paperwork in? I'm like, I don't know what you're talking about. And she's like, oh, well, there's paperwork, your DNR. And I'm like, what are you talking about? And she was like, your do not resuscitate order. We want to keep that on file and make sure that we have it for blah, blah, blah. And she handed me the paper. And then I walked out so confused of, am I dying? Is this happening sooner than later?
Why are you not resuscitating me? Did I miss a conversation?
She was like, we have a notary on staff. Like, you'll just have to sign it here. We make it really easy for you and whatever. And I'm like, but you guys aren't offering will and estate planning and whatever else, but the DNR would be here. What about my medical power of attorney? All of a sudden, I'm like, the cascading effect or domino effect of like, what else haven't they said to me? And what else aren't we talking about? And do I not have any other option? Like, my doctor didn't know that conversation happened with me from the nurse practitioner. And I'm guessing it was a checkbox at the end of the year for, you
have to have a code status on file or you'll get.
But for me, have I signed it yet? No, I didn't, because all these other conversations and all the other paperwork tied to me and my family and how I want to die.
Yeah.
None of those conversations have happened with the doctor. I've had all of them with my family. They know where I stand on this stuff. I know where they stand on, where they want me and whatever else.
Yeah.
but it's continued conversation. But to
But have we even said out loud that you don't want compressions? Like, give it a shot. If it doesn't work, stop. But like, did they even walk
There
you
was
through?
no conversation. It was papers put into my hand. It has descriptions of levels of DNR, but still, I have to go Google search the things of like, what does this mean? What are the different stages of it? At what point in my
Mhm,
life does this make sense? And
mhm,
how can I know today how I'm going to feel? I mean, with my condition, things will change over time,
mhm.
but I can't predict what that looks like. I have to fill this out with a doctor who can explain to me what is the
Yeah.
progression of my
Mhm.
like my future, my condition. What does that potentially look like?
And to
So
present it like choose right now. You could change that every other day. You could change it twice a day. But to present it to somebody of like decide and then no takebacks.
that's exactly it. So to wrap up this conversation for at least this recording, because I have a few rabbit holes to go down. But I
Yes.
would say just to tack on, like, what does death look like? And have those tough conversations with your family.
Mhm,
Reflect on the things that you're going through personally, regardless of how old you are. But
mhm,
think about what you want for your life, what you want for your death, for your family, and beyond that. And then for everyone, your parents, your spouse, whoever you're responsible for.
mhm,
The, the final takeaway, and I shared this with my family. I talked to you about this too, but I say this to my husband every day:
mhm,
live your life without regrets.
mhm.
However that looks for you, make the best decision for you every day. Does that mean
Mhm.
that life is going to be perfect? No, it freaking won't. But at
Mm-mm.
least you will die feeling like you did whatever you wanted to do in your life and you lived your life with your family the way you want to, however
Yeah,
you define family. Because if you die or your family, like you die,
yeah.
things were left unresolved. When I can
Mhm,
tell you on one side,
mhm,
you're not going to be settled. Your soul will be coming back to do different things. But on the
mhm.
flip side, for your family, don't live your life in anger. Don't
Mm-mm.
hold on to shit that you can't leave
No,
behind should you lose that someone. It's not worth it. Live your life in
perspective.
love and without
Mhm.
regrets.
Yes, and if you're afraid of death, if you're worried about what is it gonna be like to die, take control of how you live, because that will directly impact what it looks like when you
I want that to be our next episode.
die.
Because there's a lot that we can chat about just in that one topic. So thank you
Mhm.
everybody for joining us today.
Thank
Thank you,
you.
Kate. As always, I love talking to you. So till next time, keep those tough conversations going and think
Mhm.
about what this means for you. Thank you.